How far can you walk? And if you look at the wrists, you'll see the wrists have actually become smaller because there's so much joint space loss between the carpal bones. Do you follow? So this is clearly rheumatoid arthritis, but I think he's in the burnt out stage of his disease.
The Department of Medicine started an upskilling project to assist our medical officers in some of Limpopo's rural hospitals. I'm Dr Mangena. I'm the head of internal medicine at Pietersburg Hospital and the University of Limpopo.
Key challenges were it was the lack of specialists. One of the strategies that we were toying with was to obviously recruit from outside of the province. Yes, it works, but it's not sustainable. And then we thought, why not develop our own specialists or supporting to develop our own internal medicine specialists within the province? And that is how the Grow Our Own Timber program came about.
One of the pillars of our program is the interaction at the bedside. This allows specialists, some of them from Pietersburg Hospital and the others who are recruited from academic hospitals outside of Limpopo. They are then able to teach doctors and medical students directly at the bedside, which is one of the best forms of teaching. And this strengthens the knowledge that can be passed on to our medical officers. The project has allowed us to interact with medical officers who are often based at rural, far-flung hospitals where they may not have enough supervision from senior medical doctors and from medical specialists. Additionally, the project allows us to send specialists led by Prof. Kala, a rheumatologist, to visit doctors in their own hospitals, as well as to bring expert medical care to patients who are in these hospitals.
He has lumbar radiculopathy, which was diagnosed in 2011.
The important question that we need to ask ourselves in this patient is, how active is the disease at the moment? How do we assess how active is the disease? Basically, they use what they call a disease activity score. And they put a 28 there because we're basically looking at 28 joints, which is very easy to remember, because if you look at your hands, you've already got 5, 5, 10, right? And 10, 20, and the wrists 22, elbows 24, shoulders 26, and the knees 28. You understand that? So we use the 28 joint count.
Through this program, we are seeing a lot of doctors wanting to start specializing in internal medicine. And obviously, hopefully, we'll be able to retain them in the province once they have specialized.
Over the last few years, we've been able to motivate our young doctors at these rural hospitals. In addition, some of the medical officers who participate in this program will be able to sit for the diploma in internal medicine examination. And over the last 3 years, we have already produced 3 graduates from this diploma project.
My name is Dr. Perez Montserrat. I am a registrar in Polokwane Provincial Hospital. I started last year in 2021, and I first was exposed to the Grow Our Own Timber program in 2020. And I had been placed in internal medicine, which I knew was one of my interests, but I really wasn't so confident in it. My experience during an internship had been minimal. Hearing about this program, I decided to give it a shot. I was then introduced to coming to this tertiary hospital, to Polokwane Provincial, once a month for a week at a time, which meant I had exposure to all the specialties. And then when I would go back even to my little hospital in Glencowie, I would take that knowledge that I had learned here.
The ultimate aim of our project has been to improve the care of all the patients in Limpopo.
So I think during the time my referrals became better. I knew which patients I could handle at my local level, which patients needed to be referred quickly, and the process just became a lot easier.
We're very proud of this program. It's like a tidal wave, which still needs to be sustained so that we can see the actual impact of this program in the long run.